Good afternoon. Welcome to day 670 at the EMA office here in St. Clair County, where we bring you the weekly update on the COVID numbers. Joined here with Chairman Mark Kern and Mila Blanford, Director of the Health Department. And Mila, record numbers this week.
That's correct. Our case rate and transmission rate is very high in the county. For the period of January 6th through January the 12th, we have a total of 5,334 new positive tests out of a total of 18,435 for the reporting period. The age range of those positive individuals is under 1 to in their 90s. The weekly county positivity rate is at 28.9% with the 7-day rolling average match at 28.9%. The regional positivity is at 25.6% as of January the 9th. Our case rate today is 2,032 per 100,000 population. Last week this time it was at 789 and the week prior was at 435. So they can tell you how it's grown over the last 2 weeks. Anything over 100 per 100,000 is considered high. So this is one of the higher numbers that we've seen. Unfortunately, we do have 19 new deaths to report today. We have a female in her 40s, 3 females and 5 males in their 60s. 3 females and 2 males in their 70s, 2 females and 1 male in their 80s, and 2 females in their 90s. Or, I'm sorry, 2 males in their 90s. Countywide, we have conducted a total of 649,690 tests, consisting of 58,896 positives and 592,794 negatives. Total deaths to date is 627, and our condolences go out to those families. Statewide, we've tested a total of 47,411,987 tests. The total positive out of that number is 2,522,953. That's an increase of 227,508 from last week. Total deaths to date is at 28,804, and that's an increase of 648 from last week. For St. Clair County hospitalization numbers, the number of COVID-related hospitalized patients in St. Clair County is at 136. Regionally, we're at 285. Number of patients on ventilators in St. Clair County is at 5. Regionally, we're on 19. And Randy, if you want to share the graphic the hospital provided this week. You can see that we have 136 hospitalized patients in St. Clair County. That's in comparison to 128 from last week. About 70% of those individuals are unvaccinated. We currently have 15 in the ICU. That's down from 18 last week, which is about 60% unvaccinated. We have 5 on ventilators currently. That's down from 12 last week. So 100% are unvaccinated that are on the ventilators. And Randy, if you'd like to bring up the age graphic. You can see in our under 10 and under age group, we have 9%. In the 20 and under, we're at 14.3%. Comparative to last week, we're at 19. In our 40 and under age group for positive tests, we're at 59%, which is similar to what we had last week. All right, for congregate care, announcing those that are in outbreak status. We have Bree of Belleville with 14 cases, Bree of Mascoutah with 7 cases, Brightly Senior Living with 1 new case, Cambridge House of O'Fallon, 3 new cases, Cambridge House of Swansea, 2 new cases, Caseyville Nursing and Rehab, 9 new cases, Cedar Ridge of Lebanon, 12 new cases, Cedar Trails of Freeburg, 4 new cases. Colonnade of O'Fallon, 14 new cases. Freeburg Care Center, 21 new cases. Four Fountains, 18 new cases. Gateway Foundation, 5 new cases. Integrity Healthcare of Belleville, 16 cases. Integrity of Healthcare Smithton, 1 new case. Knollwood Retirement Center in Caseyville, 1 new case. Lebanon Care Center, 5 new cases. Mercy Rehab and Care in Swansea, 17 cases. New Athens Home for the Aged, 3 cases. St. Paul's Home, 18 new cases. Swansea Rehab and Care Center, 1 new case. Sycamore Village of Swansea, 3 new cases. And Willow Creek of Belleville, 1 new case. So statewide, we've seen an increase overall in hospitalization. We know that Omicron is out there. We also know that a lot of the hospitals have reduced staffing. Here regionally, we have about 11% bed availability. So if you're out and you need testing services, if you don't have any other healthcare concerns, we recommend that you go to a testing center. Likewise, if you are visiting the ER, please keep in mind that those folks have been working long hours for a long period of time, and they're trying their best to meet everybody's needs. We talked last week about Pfizer reduced their time interval between the primary dose, the first and second doses, and their booster from 6 months down to 5 months. IDPH is currently looking at reducing that also for Moderna. It's not official yet, but we expect that in the near future. And then IDPH did adopt the recommendation for boosters for 12 to 15-year-olds. So you can now get those at our 330 West Main location. You can get all 3 types of vaccine there Monday through Friday from 10 to 6 and Saturday from 8 to 4. You do not need an appointment. You must be 12 or older. If you need an appointment for a 5 to 11-year-old, you can go to our website and sign up there.
Great. So Mila, at 330 West Main, talk about the clients that we're getting or the people that are coming in. Are they mainly now getting boosters, or do we still have people that are realizing that vaccine is a good thing?
We still have people that we're getting that word out, obviously. So obviously our third doses and our boosters comprise the majority of doses given at that location and countywide as well. However, we also see a good number of first doses that people are still getting the word, and they are coming out to become vaccinated.
And it's never too late
That's
to
correct.
get vaccinated. Is
That's
that right?
right.
I mean, we're going to be in this for the long haul, and so you really need to get vaccinated now.
Right, and so you hear terminology out there. We've talked about being fully vaccinated for a while now. That means if you're getting a Moderna or a Pfizer, that you've had both the first and second dose. J&J is 1 dose. But now you hear about being up to date. If you're up to date on your vaccinations for COVID, that means you've also received all of your eligible boosters, or if you're eligible for that third dose, that you've received that as well.
So everybody, let's get up to date. How about that? That's the slogan for the day, Herb. Write that down.
Up to date.
All right, let's look at the zip codes for today. Biggest numbers we've ever seen. 62059 up 9 to 88. 62201 up 109 to 1164. 62203 up 148 to 1342. 62204 up 96 to 916. 62205 up 118 to 1365. 62206 up 262 this week to 2,847. 62207 up 152 to 1,399. 62208 up 372 to 3,512. 62220 up 549 today to 4,061, and they broke the 4,000 level. 62221 went up 704 to 5,730. 62223 up 323 to 3,439. 62225 up 90 to 512. 62226 up 658 to 6,280. 62232 up 135 to 1,671. 62239 up 60 to 962. 62240 up 29 to 315. 62243 up 117 to 1,312. 62254 is also up 117 to 1,322. 62225 up 16 to 181. 62257 up 36 to 603. 62258 up 248 to 2,058. 62260 up 163 to 1,406. 62264 up 52 to 701. 62269 leads today with a rise of 743 COVID positives to now 6,764 total. 62282 up 16 to 119. 62285 up 99 to 1,025. And finally, 62289 up 3 to 93. Regional positivity is up today, as we said, to 25.6%. And the county's 7-day rolling average tops out, and it's up again today at 28.9%. The numbers are really up there, Herb. I think the Christmas spike, the holidays, I think are contributing. We saw this last January. And of course, these numbers don't include all of the home tests that people do. We don't include those in the numbers, so I think the positivity rate probably is a lot higher than what we see here.
Exactly, and we keep talking about that.
We know for a 30-day period, I don't know the exact date range, there were over 770,000 laboratory tests administered. In that same period, around 800,000 over-the-counter tests were purchased. Now, that doesn't mean they were used. That doesn't mean that they were positive. But it's kind of a comparison in terms of usage across the state. So we know that right now in St. Clair County, we're just under 64% vaccinated. And we also don't know when this peak is going to happen. We know we're in a surge, and this could go on for several weeks. So again, it is the best tool that we have in our tool belt for you to be vaccinated and boosted when you're eligible.
Well, and I think it's worth mentioning the testing side at the mall is still operating, and they're averaging, 600 to 700 tests there now this week. So if you feel like you've been exposed, or if you're not feeling well, it's free. I know some people are saying, well, you got to go and wait 2 or 3 hours, but how do you put a measure on time when you're going to find out for sure if you've been exposed, if you've infected somebody? You don't want to do that, so go spend whatever that time limit is. They're doing the best they can out there.
They have vaccine available there as well,
They have
Monday, Wednesday, Friday, and Saturday from 8 to 4.
Yeah, exactly. So, we're trying to do everything we can to make it as easy and simplified for everybody to take advantage of something that's going to help you and your family, your friends. As Mila said, it's the best tool that we have in our toolbox, helping to try to get out and stay in front of this thing. But the way these numbers are, like the chairman said, January, these are the all-time high numbers. And we still got several weeks, it looks like, before we start seeing them level off. We are doing a mask giveaway at your request. We put out a notice to our communities, and I think, Randy, you got a list of the communities that have sent in already that are asking for some more masks that they're going to give away in their communities. We had them put the list up there so you can take a look at that, and they have until the close of business today, the communities, to let us know what their needs are, and if they don't make it today, if they call tomorrow, we're going to take care of anybody that needs them.
So that list is the request, the communities that have requested help with masks.
Right,
So,
and then those will start being distributed to those communities tomorrow, and then however those communities are going to take care of getting them distributed will be up to them.
and every community in St. Clair County received an email
Yes.
saying, send us an email saying you want to be in the program, and so we're waiting. We have a lot of masks, and we have enough for our community, so we're looking forward to everybody participating.
Right, so we'll be working on that starting tomorrow for those communities. And if you're following this, and if you live in a community, check with them and find out. And if they haven't put the request in, get them to us. And we want to make sure we get those masks out and people can use them, because that's part of the defense of this thing.
And for the unincorporated areas, Herb, they'll be able to go to these communities also. If a town is close to you and you don't live in the limits, we're going to be providing extras for the unincorporated areas, and we'll also be available at certain places for unincorporated areas to pick up masks.
Exactly, or you can always call us here at the EMA office and we'll put you in the right direction on who you can contact. So that's our weekly report here. You hear the numbers are high. I wish we could flip the switch and get them back down to where they were last year, but it's each and every one of our responsibility to work towards that. We said teamwork for 670 days now, and we're relying on the team to continue to try to help get these numbers back down. Tell your family or friends, if they haven't been vaccinated yet, try to explain to them that's the most important thing we can do right now. I don't know anybody that has growed extra fingers, heads, or whatever from the vaccine. I don't want to hear all that. What I want to hear is, how are we going to help get these numbers back down to where we can get back to some sense of normal? So if anything comes up between now and next Wednesday, we'll let you know. But otherwise, everybody be safe out there, and we'll see you back here next week. Thank you.